Hi, everyone. Thanks for your time. What's very close to my heart and my team is preventive medicine. What is preventive medicine? What we can do to prevent the onset of disease. So today and over the next couple of weeks, we are going to be looking at the heart, the liver, the kidneys, the lung, the brain, the immune system. What can we do to prevent the onset of cardiovascular disease? What we learn today doesn't mean that you may not fall sick. Okay, as we go through the risk factors today, a lot of us may go through heart problems, no matter how much we exercise and how clean we eat. The idea is to identify there are risk factors for every single disease out there, every single disease. And we're going to go through that because when you're aware of the risk factors, you may find a genetic predisposition today. And that's okay. That may just be one of the risk factors. But what if you have 5 more? Like with your genetic predisposition, you have an alcohol problem, you have a smoking problem, then you know that your risk is higher and higher. But if I remove 3 or 4 of them, I'm left with only one, which I may not have too much control over, which is my genetic predisposition, but there is still something that you can do. So if any of you already have heart problems, you can still listen to this session because you get a couple of ideas of what you can still do. It doesn't mean that if you have a cardiovascular issue, you cannot get better. The whole point is if you do have that cardiovascular issue and you recognize today that I still have some risk factors, which if I take out of my life, I can actually get better, even though you may have a cardiovascular problem right now. So we're going to go through all of these topics over the next couple of weeks, because I think if there's anything that we've learned from the pandemic, it is that prevention is better than cure. No matter what, you may have wealth to buy any medicine, buy any hospital bed, get the best doctor on board, whatever it is. But prevention is better than cure. It's as simple as that. So yes, while the world may have quick fixes for us that allows us to continue eating junk food because, hey, there's a pill if your sugar levels go too high. Hey, here's another pill if your cholesterol levels went too high. I think the world has woken up, or most people, to realize that now we want to start getting better. We don't want to get sick in the first place. We want to look after our body. So let's start talking about the heart today. I'm going to keep it very, very simple. We're going to talk about risk factors. Number 1, you cannot live without the working of your heart. It's as simple as that. The day your heart ceases to function is the day that you die. The day that your heart is unable to pump blood to trillions of cells in the human body is the day or the minute that your body slowly starts to die. You can get a stroke, brain stroke, heart stroke, paralysis, because there's insufficient blood. What does blood do and why is it so important? The heart pumps blood. Blood carries nutrients from the food that we eat and oxygen from the air that we breathe, the trillions of cells that require it for survival, for life. It's as simple as that. If we don't have oxygen, we die. So while the lungs may be working well, your heart may fail you. Your lungs are taking in the best quality oxygen, the best capacity of oxygen, but if your heart can't pump it to trillions of cells, it's of no use, which is why in integrative medicine, you can never separate diseases. If you have a heart problem, you also have to look at the health of the lungs. If you have a lung problem, you have to look at the health of the heart, because everything is interdependent on each other. Everything works together. It's not like your body isn't like a car where you take it to the garage and you say, okay, I'm going to just change this part today and go back driving. Or you can just say, I'm going to change the oil and that's about it. You don't check the entire car to see if the brakes are working, the brake fluid is right. Is it rusting from beneath? You don't treat the human body like a car. Everything. So anything, like someone says, hey, Luke, my hair's falling. For me, my mind automatically starts thinking about several reasons. Yeah, you may want a shampoo, you may want a cream, you may want a supplement. That's on the surface. But beneath the surface, the question that goes on in my mind, why is your hair falling? Is it a gut issue? Do you have a leaky gut issue? Do you have a malabsorption issue? Do you have a deficiency of iron? Do you have a deficiency of biotin? Okay, do you have an autoimmune attack on your hair follicles, which is leading to alopecia? Because everything that happens in the body is an indicator or a warning that something is going wrong. And if we listen to it, guess what? We can get better. We can get better. Today, you may have done your blood test and you realize you're borderline cholesterol. And you're not a heart patient, relax. Your body's just telling you, change the way you eat. Maybe get a little bit more exercise, cut down your stress levels, get a little more sleep. So we shouldn't have to react. Of course, we'll get reactive when we waited till the end. And then we have problems in our 2D echo, in our stress tests, our triglycerides are all over the place, I have high blood pressure, I have diabetes, everything together. Then they're not warnings, they're alarm signals, okay? So one thing that I want you to know, because everyone is so scared today about human health and everyone's health obsessed and we're trying to do so much to get better. you can stop that right now, because never forget that you have an intelligence within you that is working 24/7 to protect you, to identify problems that are occurring in the body, to fix problems that are occurring in the body. That system is working for you 24/7. And that's where I would put all of my investment in that system. Of course, I'll take out a little bit of investment, like, some people will invest a little bit in Bitcoin. Foolish people will invest everything in Bitcoin. Some people will invest a little bit in the stock market. Foolish people will invest all their money in the stock market. The idea is to diversify. I would invest most of my time, energy, and my money in maintaining my intelligence, which is working for me 24/7. Then I may put a little bit of investment in good, healthy food. I may put a little bit of investment in a nice exercise program or a good mattress to sleep better at night if that's my problem, or, in taking some yoga classes or learning to meditate, or, if my work is stressful, can I reduce my stress at work by hiring more people? So I would rather save my health and spend that money to hire more people so my stress gets reduced. So you see, it's diversification. Each of us are different, but some people say, no, I'm just going to make money, save it in the bank, not sleep well at night, put all my job in my career. And at the end of the day, your money in the bank can't get you peace, can't get you quality of life, and in most cases, can't get you healing. You have to do it yourself. So you should never forget that we have a beautiful process called angiogenesis, working for you from the time you are born. Angiogenesis is the body's intelligence and system of growing new blood vessels constantly. You fall, you get hurt, your skin is cut. What repairs it? New blood vessels growing. One artery in your heart gets blocked. How come you don't drop dead immediately? Of course, some people do drop dead immediately when you find multiple blockages at over 80% in several arteries. Now the arteries are blocked. They cannot flow blood to the brain or to the heart, and the body dies. Sudden heart attacks, swift cardiac arrest. Okay, but remember angiogenesis. When one artery gets blocked, the system recognizes this and it starts to grow new capillaries. Okay, but for most of us, unfortunately, because of poor lifestyle, poor food, sleep deprivation, stress levels, angiogenesis doesn't work the right way. So it's unable to protect us. So they find one blockage, it starts growing another artery. When you look at the scans of mountain climbers, their hearts are naturally bigger. Their hearts have evolved to be bigger for the mountain climbing. More oxygen, to take in more oxygen, because as you go up, the oxygen levels are less. So guess what? They don't die. The heart adapts by growing new capillaries. That is the beauty of angiogenesis. And never forget that all of us have that inbuilt mechanism. For most of us, it may not be working that well. So angiogenesis is a whole different topic, which we've spoken about. Tina, if we've done a video on that, you may want to send it to everyone watching today. You can send them the video on angiogenesis. Let's move on. So today you have a pill for cholesterol, you have a pill for high blood pressure, a blood thinner, but now it's about time that you recognize what is the root cause. Why do I have high blood pressure? Why is my cholesterol all over the place? Let me do something about it, because after a while, your doctors are going to tell you, hey, you're on too many pills. There's nothing more we can do. Oh, I'm sorry, you're sick today because the side effects of the statin is causing this problem. The side effects of your heart problem, or the side effects of your diabetes is causing your heart problem. You don't want to reach that point. You don't have to. You don't have to. When you invest in prevention, it's inexpensive. Yes, it becomes expensive when you lose your health. There's no doubt about that. It becomes expensive. But prevention is inexpensive. And today we're going to go through the risk factors right now. Look around if you have no hope. There are so many bypass patients who have gone through bypass today. They're running marathons. They've changed their lifestyle. They're climbing mountains. They're lifting heavy weights. They've built incredible bodies. Their heart tests and scans year on year are perfect. They've rebuilt their systems by changing their lifestyle. So it is never impossible. And never blame age for it. That, oh, I'm in my 60s now, it's going to just get bad and I have a heart problem. I know people in their 80s who have gone through bypasses and are living beautiful lives. So that person can be you. What have they done differently? Nothing. They've changed their lifestyle. I also know people who have spent thousands of dollars on the best hospitals, the best doctors. I don't have a problem with that. But they've not changed their lifestyle. And they constantly get blockages. They constantly have to put the second stent, the third stent, the fourth stent. Anyone having 2 or 3 more stents is a clear reflection that they have not bothered to change their lifestyle. How many more stents are you going to put in your heart? The medical world is always going to have something to give you. My point is, take it if you really need it. Other than that, if you've not changed your lifestyle, then it's your fault. Okay, so when it comes to prevention, what's your game plan? What's your vision? Everyone should have a vision of prevention. I want to look after my heart. I want to do something for my brain. I want to look after my liver. I want to look after my kidney. The beauty is you just take care of your overall health and your body looks after every single organ. And today, if you have slight cholesterol levels or slight high blood pressure, then your body's trying to tell you, you have a small problem with your heart. So you focus more of your efforts, more of your game plan, and your body has the ability to change and to recover. So genetic predisposition. Yes, your checkups have to be regular, especially post the age of 30. You want to make sure that you get your 2D echo done. You want to make sure that you get your stress test done once a year, and you have your appointment with your cardiologist. He'll make you do your CBC, your lipid profile, so you can maintain your triglycerides, your good cholesterol, your HDL, your bad cholesterol, which is the LDL. I would add, another part of your risk factor is to add your CRP levels. That's C, like cat, reactive protein. Now, this is an inflammatory marker, a very good indicator to tell you about how much inflammation you have in your body. If your CRP comes high, it doesn't mean you have a heart problem. It could mean many, many things. It could mean you've hurt yourself, you have inflammation in your body, you have an injury, it could be anything. So don't worry about it. These are indicators that helps your doctor figure out and connect with the other parameters in your blood report to come to a complete picture of, hey, I think you have this problem, this is what you need to do, or you're absolutely fine, don't bother about it. Like an arthritic patient, the CRP levels may be high, it doesn't mean that they have a heart problem. So all your medical lab reports are always indicators. Never look at one parameter and get worried. They have to be correlated with several things. So for example, people come to me and say, hey, Luke, we have cholesterol, we need to start a plan, we need to do this. And I look at their cholesterol levels and they're absolutely fine. They are looking at their total cholesterol. You have to look at the ratio. So if your triglycerides are excellent and your HDL is excellent, you don't have a cholesterol problem. But if your triglycerides are way high and your HDL, which is your good cholesterol, is on the lower side, yes, you got to start making lifestyle changes, and you may require medication if your levels are too high. You have genetic predisposition. You also have high blood pressure and other conditions. So the whole point is know your family history. Okay, know what they had. Were they patients of hypertension? Were they patients of high cholesterol, high triglycerides? Did anyone die of a heart attack at an early age? Get information. Don't get worried. Just get information and do your regular checks. In most cases, your doctor will say, hey, listen, just look after your lifestyle. You have nothing to worry about as of now, and do your regular checks. So that's extremely important. Another risk factor, if you are diabetic, okay, if you are diabetic, it's not your fault. Maybe it's your fault. I don't know. But I'm talking about type 2 diabetes. If you have type 2 diabetes, you do what you can to get your blood sugar levels in check, better, and reverse it. Living with type 2 diabetes is not okay. Yes, of course, the medication will suppress your levels. Of course, your medical parameters will look better because your doctor is playing with your medication, which is necessary. Because if you have uncontrolled blood sugar levels, that's going to create more damage. Why is diabetes bad? Diabetes damages, the high blood sugar levels damage the small blood vessels in your kidney. It's called microvascular damage. So every time your blood sugar levels spike all over the place, it starts damaging blood vessels that supply blood to your eyes. So you have macular degeneration or nerve endings. Diabetics, their nerve endings start tingling. They get tingling pin-like needle sensations below their feet, the extremities. Or you'll see a diabetic's wound doesn't heal. They have to get amputated. When the wounds don't heal, it clearly shows you that angiogenesis is not working. Your blood vessels are not strong enough or not enough to carry blood to the wound to heal it. If the wound can't get blood, which carries oxygen and nutrients, it begins to die. It begins to rot. The flesh begins to rot, like in amputation cases, in wounds that don't heal, that breed gangrene. So now you understand what's happening. Blood sugar levels in diabetes can lead to damage. So at the most, if you cannot reverse your type 2 diabetes, at least work and check your levels very, very often to make sure they're not spiking up and going too low, because it's the fluctuation in your blood sugar levels can destroy microvessels, microvascular damage of any blood vessel, including your heart. So diabetes may be a separate disease, but it is a risk factor for heart disease. So your heart may be in perfect condition, You also got, but you have diabetes. It's a risk factor. It is not to create fear in you. Don't get me wrong. These are risk factors which you need to know about. It's like your report card. You get a report card in school. It's not to make you fearful. It's to tell you which subject you're good at, which subject you need to improve on. Okay, so diabetes, yes. It does damage to the larger cells, which are called macrovascular cells, like the arteries in your heart that carries blood to your brain, to the lower part of your body, to your kidney, to your liver. What destroys that? The third risk factor, which is high blood pressure. Now, when you have high blood pressure, just imagine, okay? Imagine you have a pipe. Okay, this is the pipe, okay? And I'm passing water through, okay? And now what happens is this pipe starts getting smaller and smaller because it's rusting inside. There's a thick coating of rust, but I'm sending the same pressure of water through. What's going to happen? There's going to be a back pressure. That's what high blood pressure is. So when there is damage to your blood vessels, they create small injuries in your blood vessels. These injuries now fill up with plaque or cholesterol, further decreasing the size of the blood vessel. So now blood cannot flow the same way it used to flow through that blood vessel. So your pressure goes up. Hypertension, a sign that blood flow is improper in your system. So now there's a pressure. The heart has to increase its pressure because it still needs to do its job of keeping you alive, pushing blood through those arteries so it can reach trillions of cells in the human body. And as the pressure goes higher and higher, you know that your arteries are more and more damaged. So the high blood pressure creates damage to your arteries. The diabetes also creates, which is why we say a combination of diabetes and a combination of high blood pressure is literally a cocktail for kidney disease, chronic kidney disease, because it starts damaging the nephrons in the kidney, which is nothing but blood vessels that nourish the kidney. So the kidney function starts to decrease, and likewise the heart function. So we need to understand that even if you have blood pressure, it's a risk factor. Just taking your blood pressure medication. Today morning, I had a consult with a patient who takes 4 different kinds of blood pressure medication because the lifestyle hasn't been changed. And the doctor says that, Luke, I understand. I don't want to put him on 4 medicines, but he's not changing his lifestyle. I need to protect his heart. And the doctor is absolutely correct. My point is, high blood pressure is a risk factor. You can't just be saying, hey, I'm on diabetic medication, I'm good. I'm on high blood pressure medication, I'm good. No, you're living with risk factors. So if you have genetic predisposition and diabetes and high blood pressure, you have 3 risk factors. Now, risk factor number 1 was genetic predisposition. Not much we can do, but I can take care of the diabetes and the high blood pressure, right? So I slowly start to work with every risk factor to make it better. The next risk factor, and the risk factors that I'm taking you through are not based on order of priority, okay? The next risk factor is smoking, whether you like it or not, whether you smoke or you're a passive smoker, whether you're around people who smoke continuously, it is affecting you. It is affecting the process of angiogenesis. The smoke is causing damage to your arteries. It's a no-brainer. Medicine, science, lifestyle medicine, everyone has enough science to show you the damage behind it. It's a no-brainer. It's as simple as that. If you are a heart patient, if you don't want to be a heart patient, you got to look at giving up your smoking habit. I'm talking about shisha, I'm talking about cigarettes, I'm talking about any kind of smoke, okay? A lot of people cannot stop smoking. So let's be fair to that population as well. They cannot and they don't want to give it up. What's the next best thing that you can do? Because there's always something that you can do. Then you look at the vitamins that get depleted with smoking. So whether it's zinc, whether it's vitamin E, vitamin C, there are certain vitamins that get depleted when you smoke. At least make sure you're putting those vitamins back into your body through your food or through supplementation with professional advice. So I understand you can't stop smoking, but at least do something that can possibly negate the effects of smoking, because smoking is damaging your arteries. So we spoke about high blood pressure, we spoke about diabetes, smoking, hypertension, which is high blood pressure again, creates inflammation in your body. Inflammation, all cardiovascular disease are inflammatory diseases caused by high inflammation. When a blood vessel gets damaged, it gets inflamed. Now, because of the constant damage, because your blood sugar levels are high, or your blood pressure is high, or you're eating a diet which is rich in processed foods and sugars and refined oils, you're just going on adding more and more inflammation. So let's say we have a little fire, we lit a bonfire today, okay? And we throw a little bit of petrol, okay, the fire like booms up, inflammation. I add a little more petrol, again, it booms up. So I can keep on adding inflammation to my body by feeding it with inflammatory triggers. So whether it's refined oils, hydrogenated fats, partially hydrogenated fats, all of your bad fats, all of your refined sugars, your white flours, all of this is like you're literally feeding inflammation to your body. It is affecting your heart. It won't happen immediately. It will happen over the years, which is why we say the consumption of refined oil is like slow poison. Yes, it's cheap. It's cheap. That's what the marketing companies did. They made you believe that oil should be cheap, but good quality oil is not cheap. It is expensive. Whether you and I like that, it is expensive. Cold-pressed oils, wood-pressed oils, unfortunately, are expensive. But the cheap refined oils are like slow poison. They constantly feed a little bit of inflammation and a little bit of inflammation. Now you get diabetes, so there's more inflammation. Now you get high blood pressure, but that little oil is going into your body with every meal, creating more inflammation. And then you have inflammation that cannot be controlled. And that's why we need anti-inflammatory foods, anti-inflammatory diets. Your doctor will tell you to start walking. Your doctor will tell you to stop eating junk. They will tell you to stop eating oil and fried foods because inflammation has to come down. So it's very, very important that you do that, okay? Now, high blood pressure sometimes can be very silent. I know people who don't even know they have high blood pressure, but they do a random checkup and their levels are at 180, 200, 210. Whereas for some people with high blood pressure, you will get the indicators, throbbing in the head, dizziness, your body will start getting very cold or you'll start feeling very restless. Be aware. And sometimes if you feel these slightest changes, get your blood pressure checked, because sometimes hypertension can be silent. And by the time you get it checked, it's done enough of damage to your blood vessels. So again, prevention is better than cure. Always very important. Another risk factor is your sedentary lifestyle. If you are sedentary, sitting too much throughout the day, not exercising, not moving, sitting in one place continuously for over 1-2 hours. Yes, I'm even talking about the time you watch your movie. Even that is scrutinized today. If your movie is 2 hours, that means 2 hours of no activity. Does this mean you should stop watching movies? No. Just make sure that every 45 minutes you get up, go get yourself a glass of water, go stand up, sit down, do a squat, stretch, touch your toes, and then get back to your movie. The idea, again, is blood circulation. So lack of exercise or a sedentary lifestyle is a huge, huge risk factor for heart disease, which is why a lot of bedridden patients who may have a kidney problem or a limb problem or something are also at high risk of heart disease, which is why their movement is extremely important. So there'll be passive movement, their legs are lifted up and down, or their arms, or they're given bed exercises with resistance bands. But activity is everything because, again, it's blood circulation, which is why it is so important for us to understand we don't exercise to stay thin. We exercise to stay healthy. Always remember that. If you're exercising to stay thin, okay, you've got the wrong meaning of health, okay? You eat well to stay thin, or you eat well to stay healthy. You don't exercise to lose weight to stay healthy. It doesn't work that way. Yes, of course, the side effects of exercise are fat burn and all of that stuff, but you got to change your mindset around that. Weight loss involves the food that you eat coupled with the exercise you do, the kind of sleep you get, and your stress levels. So when it comes to exercise, what are the best exercises for heart health? Again, you don't have to join a gym. Walking, a little bit of stretching, a little bit of yoga, dancing, weight training, swimming, whatever it is, but get that heart rate up. Get that heart rate moving for at least 15 to 20 minutes continuously every single day. Now, you may be that household mom who's busy throughout the day in the kitchen, running after her kids. That's activity. That's good enough. But if you can still throw in some more exercise, that's great. The point is, start off with 10 minutes and then move to 15 minutes and then move to 20 minutes and then move to 30 minutes eventually. Anything between 30 minutes to 60 minutes on most days of the week is sufficient movement to look after your health. It's as simple as that. You don't have to do fancy stuff in preventive medicine. That's the beauty of it. Now, you may have to do all your cardiac rehab exercises and physio when you get damaged. If it can be prevented, why not? Keep it simple. Track your steps. 10,000 steps is not a magic number, but it's a great indicator that you are active throughout the day. Because even if you do a 1 hour walk, you can't get 10,000 steps. So to get 10,000 steps, you are doing a walk and you're also active throughout the day. So more than a 1 hour workout, it is the activity that you can achieve throughout the day. Keep moving. You have a desk job, you got to keep sitting, get up every 45 minutes, an hour, stand up, touch your toes, stretch a little bit, go to the toilet, whatever it is. But keep moving. Keep moving. The body is not designed to sit. That's extremely important. Okay, so now we'll recap. We have exercise, we have losing weight. Absolutely. And I'm not talking about losing weight for vanity reasons. I'm talking about losing weight for your heart. You have to understand. Okay, if you are 50 kilos, your heart works for 50 kilos. If you put on another 10 kilos, now that same heart hasn't changed in any way. It has to work for 60 kilos or 70 kilos. It will, but it'll wear out faster. Everything in the human body wears out. Your muscles, your joints, your heart, your liver. It's the aging process. You can't do anything about it, but we can slow it down. If I want my heart to beat until I'm 90, yes, I got to look after it. I can't keep it beating more than it's required to be beating. I can't destroy my kidney and my liver right now. If I needed to support me when I'm 60, when I'm 70, when I'm 80, I need to invest in prevention. So extremely important, your exercise and lose weight. Even a little bit of weight loss, 500 grams, 1 kilo a month is great weight loss. It's great weight loss. Of course, it may seem very small if you're comparing yourself with people on Instagram and Facebook and Twitter and all of that stuff. Well, that's your problem of low self-esteem, and never let that come in between your health. But okay, I have excess abdominal fat. That's your indicator. Abdominal fat is not okay. It's not okay. You have to make an attempt to reduce it. I'm also not saying you got to have a six-pack or a size 0 figure. You can have some pleasant curves and body fat over there, but if you're constantly putting on belly fat, you have a metabolic disorder. It's called metabolic syndrome. It is related, and it's a huge risk factor for your heart, whether you like it or not. So I'm not here asking you to get thin or to get fit because you need to look good. I'm here to say that weight loss, more than weight loss, your fat loss is extremely important for your heart health. Extremely important for your heart health. Even if you lose 1 inch a month, it's great for you. It's great for every part of your heart and your body. So lose weight. We spoke about refined oils, massive risk factor, white sugar, too many processed carbs. These are all risk factors. Packaged foods and all of that stuff. You're just creating a mess of your own. I'm not saying don't enjoy it. Enjoy a dessert, enjoy a packet of chips, enjoy some cookies, enjoy a donut once in a way. But if it's becoming your primary diet, you're creating more and more inflammation. You're decreasing your own mitochondrial function, which is essential for the functioning of every cell in the human body. Omega-3s, very important. If your diet is deficient in omega-3, and I'm not saying you have to take a supplement. Of course, you will have to take a supplement if you become a cardiovascular patient. But if you are getting enough of omega-3 in your diet, vegetarians from their flax seeds, from their walnuts, from their hemp seeds, so many vegetarian sources, algal oil. And if you are non-vegetarian, you get it from your fatty fish, you get it from your egg yolks in small quantities. The idea is eat a balanced diet. And if you're a professional, see that you have a deficiency because your HDL, which is your good cholesterol, is on the lower side, you may be prescribed omega-3 supplement until your levels come back up again. Not enough for fruits and vegetables is a high risk factor. Yes, there are extremes telling you don't eat fruits, it's sugar, don't eat dates, it's sugar, don't eat honey, it's sugar, all of that stuff, okay? You have to understand, okay? Is your goal weight loss or is your goal your overall health to keep you alive? I can't tell you how many of the most beautiful bodies and the most amazing physiques are now dead today because of cardiac problems. Okay, so yes, you may want to look good. Every human wants to look good, lose weight, all of that stuff. Do it the right way. If you are on diets that stop you from eating fruits, at the same time, don't overeat fruits because it will make you fat. If you overeat fruits, it will make you fat, period. Anything in excess is not good for you. So my point is a risk factor for cardiac disease and inflammation and inflammatory diseases is lack of fruits and vegetables. So you got to make sure that you have a diet that is vibrant. You have your 2 or 3 or 4 fruits a day, your vegetables, everything, your whole grains, your nuts, your seeds, your lean proteins. You have to have a wholesome, balanced diet. If you have any less of vegetables or fruits, it is a risk factor. My next risk factor, which is perhaps the biggest, and we have surgeons and cardiologists from around the world, when we ask them, Doc, you've seen so many heart patients, what's the #1 cause? Stress, 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 stress. We're talking about chronic stress. I'm not talking about day-to-day stress. a little bit of stress. Oh, I have to feed my kid, or I have to go to the market. No, that's not stress. That's your duty. Just stop complaining and do it. My point is chronic stress. You're constantly worried. You're constantly anxious. You're constantly unhappy. Okay, chronic stress creates inflammation in your body. How? Because you constantly produce cortisol, adrenaline, you burn out your adrenal glands, which is you'll get thyroid, or you'll have thyroid-related issues or endocrine system-related issues, multifactorial, but it's one of the major causes. Today, we have patients who say, Luke, I know I'm sick because of my stress. I know I'm sick. I know I got cancer because of my start rolling up joints. Everyone's doing everything. My question is, what are you going to do about it? And the question is, emotional wellness is important for prevention, not just to accept things that you cannot change. You have to learn how to let go of things that are not in your control. Most people's stress in life is caused by trying to control things that they can't. Unfortunately, yes, someone's going to die. You can't control anything, but what? You may notice a slight change in this video. It's because we had a break earlier. The internet broke and I couldn't complete the video, but I'm completing it right now. So you may just find a little change in the lighting. But getting back to what we were talking about, the risk factors for heart disease and cardiovascular. So I think by now you've understood that chronic stress is a massive, massive risk factor. And there's a lot that you can do with it. Like I said, you don't have to make it expensive. You don't have to spend money. You just got to start taking small baby steps, learning how to relax, whether it's sitting in silence, meditation, prayer, playing a game, cooking, baking, anything that brings you peace, that helps you to cultivate the practice of mindfulness. Another risk factor are your homocysteine levels. So technically, homocysteine, high levels of homocysteine is a risk factor for cardiovascular disease. Now, mostly when your levels go high, don't get worried. Sometimes your doctor will give you vitamin B12 and folic acid for a while, and the levels mostly will come down. Because sometimes when you're deficient in folic acid and B12, your homocysteine levels will rise automatically, and it can be taken care of that. But despite taking vitamin B12 and your folic acid, if your levels continue to be high, it is a risk factor, and you need to see your cardiologist, and your doctor will advise you on the way forward. But again, you have to understand folic acid is required for blood vessel health. That's why women who are moving into pregnancy are always put on folic acid way before the pregnancy, because it is required for the development of blood vessels, which means the formation of the fetus as well. Extremely important. Hypothyroidism as well. There are millions of people living with hypothyroidism, and you need to understand it is a risk factor. Okay, when I say it's a risk factor, it doesn't have to happen, but it's a risk factor which gives us enough of motivation to want to do something about it. Whether it's an underactive thyroid gland because it's malnourished or poor lifestyle, too much of stress, or whether it's a Hashimoto's thyroid, which is an autoimmune condition where your own immune system attacks your thyroid gland. You would know that when you do an anti-ATG test and an anti-TPO test. That would tell you whether it's a Hashimoto's autoimmune thyroid or an underactive thyroid gland. But that is a risk factor, and again, it's connected to the endocrine system that controls your hormones that have functions of every metabolic function in the human body. And metabolism is important for every role of every single organ, the heart, the liver, the brain, and everything. So you see, like I said, everything is interconnected with each other. So you want to do something about your hypothyroidism as well. We have videos which are posted on how you can look after your thyroid gland, how you can determine what kind of thyroid issue you have. We also have thousands of people who have used the video to reverse their thyroid. So you can be one of those people. Go watch the video, and I hope it makes a difference. If you struggle, you can always reach for professional help. Okay, so now let's start summing it up. Let's start summing it all up. By now you would have understood that elevated inflammation is a risk factor as well, which is why our diet is so important. Foods that are anti-inflammatory in nature. I'm not going to go into detail in food today. It's just all these little sessions are the importance of it. You can go and check out our videos where we talk about foods for heart disease, liver, kidney, and brain, and everything else. Today, it's about understanding the risk factors. So when your diet is less in omega-3, it's a problem. Okay, you increase the risk of your heart disease. So it's important. Don't just jump straight onto supplements, please. You can get all of this from a balanced diet. And only if you need supplements, it will be prescribed to you. But please don't jump onto supplements, because a lot of people take supplements when they're on blood thinners. And certain supplements and blood thinners together can cause you more harm than good. So it is always important to take professional advice, always, because there's something called food synergies. Certain foods work together to protect you. Certain foods may interact with each other and a medication to actually destroy you. So you want to be careful of that. The next thing, dehydration. This is not a major risk factor for people who have atrial fibrillation, which is, irregular rhythms in the heart. You need to understand that dehydration can make it worse, because dehydration causes a fall in your electrolytes, which is required for the beating of your heart, the rhythm of your heart. So please understand that even something as small as your water intake is important for you. So do not be dehydrated. So we looked at all of these risk factors together, and now we have something to work with. Your homework for today is introspect. How many of these risk factors do I have? No need to get worried about it, but all you need to do is work with your risk factors. Where can I get better? What can I do? Fine, I have a genetic predisposition. What should I do? Let me check my reports more regularly. Let me have a consult with my cardiologist at least maybe once a year. If my reports are fine, your cardiologist may tell you do it once in 2 years. Everything can be different for you because you are a bio individual. Smoking, excessive alcohol, lack of exercise, lack of sleep deprivation, and heart disease directly connected because of the inflammatory mechanism. So you need to improve your sleep. I have so many patients who have undergone bypass surgeries. They get right back to work, sleep deprivation, and they have relapses over and over again. That's not okay. Every time you go through a bypass surgery, an open heart surgery, stents, or whatever it is, puts the body into massive stress mode, massive shock. And it takes a lot of time to come out of that. So you need to understand, sometimes you got to take rest. Sometimes you got to sleep better. So these are all of the risk factors for this beautiful heart within you. You have so many mechanisms to look after it. And like I said, it doesn't mean that you may not get a heart problem, but if you do, you'll be far more equipped to come out of it in a healthier way than most people. Sometimes whenever you come across a cardiac arrest patient, a heart attack patient, you know that it had built up to a point where the body couldn't take it anymore. The heart shut down. So it was a build-up. It just doesn't happen. It's a build-up. So if we're getting these small little indicators, the human body is always talking to you. It is always whispering to you. What's going wrong? Stop this. Don't overfeed me. Don't overtrain me. Please, I need movement. I need more sleep. The stress is too much. I'm getting high blood pressure. I'm getting a migraine. Listen to the whispers of the human body, because soon the whispers will become screams. And screams are also ignored. We also ignore the screams. And then that moves us into diseases. Some people recover, some people don't, some people die. Now, we don't know in which category we're going to fall. So prevention is better than cure, and prevention is your best investment. Now, preventive medicine does not mean that allopathy and doctors and cardiologists are bad. Please, integrative medicine, preventive medicine includes everything. You need to get your checkup done. You need to see your cardiologist. If you need to take statins, he will give you statins. But then you have to look at how you manage the side effects of the statins. We know that statins deplete CoQ10 and it depletes selenium, which is required for every function of the body. So if you don't put selenium and CoQ10 back into your body, so a lot of doctors, I'm not saying all of them, but a lot of doctors will prescribe a CoQ10 enzyme and will also give you a selenium or a multivitamin along with your statin to manage the side effect. But many don't, and you start getting muscle spasms, dark skin, tremors after a while. That's the side effect of the statin. Every medicine has a side effect, starting from a paracetamol to a Tylenol to a statin to a chemotherapy. And it's not a problem as long as you are managing the side effects, addressing the root cause, and making it easier for your body to recover and your doctor to get you off medication. Is it possible? Of course. We know so many patients today where their own doctors have said, hey, we can start tapering you off your meds because, it's looking better. And after a while, they say you no longer need the meds. Of course, some people who have a very strong genetic predisposition, they may keep them on the lowest dosage because of the genetic predisposition that can come up anytime. But for everyone else, there's a possibility to get off your meds, keeping your doctor in the loop. So it's always integrative. What do you need to get better? You need a doctor? Good, you got a doctor. You need nutrition, you need a yoga therapist, you need someone to help you with mindfulness, whatever it is. Put that team together to get your game plan strong. When you have a strong game plan, that is prevention. It's as simple as that. Like you invest everywhere else, the biggest investment that will compound over the years for you, save you a lot of money, save you a lot of suffering, is the investment in your own self. Number one, in your own self. You know, they say there are 7 wonders of the world or 8 wonders of the world. Well, for me, I mean, they're all beautiful places, monuments, whatever. I think the biggest wonder in the world to me that still keeps me in wonder and awe is the human body. You know, I mean, even scientists, I mean, top scientists, doctors, we don't understand parts of the human body, how they work, how they support us, how they adapt, how they move around a virus, how they move around a tumor, how they start doing, you know, what our body does. It's intelligent. Harness the intelligence of your body in your game plan for prevention. So thanks for your time. I hope you will use this to make a better you. And we will send you as many videos as we can. I mean, everything I've spoken about, there's also a solution. So whether you're on a statin, there's a solution. Whether you want to learn to meditate, there's a solution. Whether you want to look at the foods that can help you with triglycerides, lifestyle changes, just go onto our YouTube channel. Everything is out there. Use it to the best of your ability. If you need professional help, reach out to the right professionals who can help you. Have a great day.